Okay, so good morning, everybody. I'm very happy to be here with you. We're going to be talking today about acne treatment and the pathology of the acne, the active ingredients, and how we build the correct protocol. Okay, so let's start a little bit with the pathology of acne. I want to start with the important difference between comedones and papules and pustules, because when we understand those differences, we can build very, very accurate and good treatment protocols. Okay, so when we're speaking about comedones, actually this is a problem of hyperkeratinization of skin cells. It's not a problem of hyperproduction of the sebum. It's not overproduction of sebum, but hyperkeratinization, skin cells that should go out do not leave the skin. They stuck inside and form a clog in the superficial layer of the skin. So the best way to treat comedones is to give our patient agents or ingredients that exfoliate the skin. And the best exfoliators for comedones are alpha and beta hydroxy acids because they exfoliate the most superficial layer of the skin, and this is when we have the problem. So when our patient will be using a product with alpha or alpha beta hydroxy acids, first, the drainage of the comedones, removing the drainage of the comedones will be much easier for the cosmetologist. And B, less and less and less new comedones will be formed. So each and every patient with comedones should be getting from us alpha or alpha beta hydroxy acid product. We cannot only drain comedones without giving product. This will not treat the root problem. To treat the root problem, we have to get him into the clinic and do the treatment and drain the comedones. And meanwhile, every evening, he should be using Bright or Lactofil. Those are two products, two BIOFOR products, Bright or Lactofil. So of course, some of our patients doesn't have only comedones. Some of them have comedones and papules and pustules. So some of them it's really only comedones. Some of them have papules and pustules without comedones. Some have mixed of all of them. So we're going to be speaking about all of the conditions. But first, I want to divide the problem of comedonica from the problem of papules and pustules. So, now let's speak about papules and pustules. Okay, so when we speak about the pathology of papules and pustules, we're speaking about other events underneath the skin. So when we have papules or pustules, we indeed have excess sebum production. In this condition, we have excess sebum production. Another thing, we have clog, but the clog, by clog I mean dead skin cells that did not leave the skin. So we have clog, but the clog is very deep, is inside, is not in the superficial layer of the skin, like with the comedones, but in a deep area, such deep that the alpha beta hydroxy acid, when we put them to exfoliate the skin, does not reach this depth. Okay. Mm-hmm. Okay. So we have also a hyperkeratinization, but the problem, the clog is deep inside. Meanwhile, the excess sebum, the sebum is produced and cannot go out. So we have an area that a little bit goes higher because of the huge amount of sebum. And if we were to use alpha and beta hydroxy acids, they are not a sufficient solution because they cannot exfoliate inside. Also, they cannot regulate the amount of sebum secretion. So they are not the good solution. We have another solution. Okay. So if we want to treat the papules and pustules, we need an ingredient that can regulate the amount of sebum secretion. and can solve the problem of hyperkeratinization from the inside, not from the outside, but from the inside. Such an ingredient is azelaic acid. Azelaic acid can control the sebum production. This is one. Two, it's regulating the skin cells turnover, so the skin does not form any clog inside. And the third thing, azelaic acid is also antibacterial, which is very, very important because we have bacterial infection inside the papules and pustules. And four, it's anti-inflammatory. So, so basically, it treats all the four pathologies of the acne. Now we have three azelaic acid products, three different azelaic acid products. We have Azelite, we have Azelite Plus, and AzoCare. Later on, we will see which are the cases that each one is adequate and more accurate to give it to the patient. Okay, so if we will have a little quick review, Lactofil and Bright are the ideal treatment for comedones. Bright will be given to the fair skin, like Fitzpatrick 1, 2, 3, even 3.5. And Lactofil is suitable for all the skin types, including the dark skin patients. And therefore, comedone treatments, if I didn't say. Okay. So let's have a very quick review of the acne products. Soapless soap. It doesn't look like this these days, but soon enough you should get this package, this white package. So this is the soapless soap. Not every patient has to get the soap. If you can afford the soap, it's better. But this is not the treatment products. This is an additional product that improves the treatment. Okay. Dermapil, it's a lotion, contains alpha and beta hydroxy acids, also a little bit sulfur, tea tree oil. It's good for very superficial acne. Azelaic acid products, which are Azelite, AzoCare, or Azelite Plus, contain, each of the three contains azelaic acid. This is actually the main treatment for all the for most of the acne patients. Okay, Cure is a product that we could use in as moisturizer also, but it contains ingredients antibacterial and anti-inflammatory. It's very calming moisturizer, so we use it with our acne patients, even all over the face, not only in the affected areas. As a product that can speed up the healing of the skin, especially if the skin is reddish, inflamed, or severe acne. And calming mask. Calming mask is actually not only acne treatment. This mask is very, very relaxing, antiseptic. You know, antibacterial, and recovers the stratum corneum after damage. And we use this calming mask in acne patients that are inflamed with all kinds of inflammation. Okay, so we have it in a cabin size to use in the clinic. After, you know, after invasive treatments like mesotherapy, like IPL, like deep peelings, like all of the irritating treatments. So we have a cabin size, and we have the little size of 50 ml for the client for home use. Also for home use, the client could use a calming for all the sensitizing condition, all the condition when the skin is red and irritated and itching, tingling, even if after burns or insect bites. This is a very useful calming mask and very effective calming mask. Okay, so we discussed the two conditions of comedones in one hand and papules pustules in other hand. And I said that many patients have them both. comedones and papules and pustules. So let's have a look on some cases when we have both, and let's understand how we start the treatment, the home treatment. Let's speak about home treatment, because you want to translate?
No, continue.
Because we know that bright and lactophil are very good at comedones, and azelaic acid is very good in papules and pustules. What do we do when we have them both? Do we use the two products at the same time, we combine, or other way? So we in BIOFOR recommend to start and treat first the acne, the papules and pustules, before we get to the comedones, because the phenomena that is more disturbing, more prominent, more, let's say, not nice looking, and more disturbing the patient is the acne. So we want to start by treating the acne and not wasting treatment days on the comedones at the beginning. Have the client satisfied and give him a improvement at the beginning, and then later on we will speak about when we should combine the products for the comedones, but not at the very beginning. Another very important point: if we were to give our patient bright or lactophil to apply on papules and pustules, which we risk in irritating the skin. Alpha beta hydroxy acids on this condition, on papules and pustules, can irritate the skin and can cause exacerbation of the acne, aggravation, like the acne will get worse, and we don't want it. So not only the alpha beta hydroxy acid do not contribute and do not treat the papules and pustules, they also can aggravate the acne. So we avoid using the alpha beta hydroxy acid on the active acne, and we wait until a later stage. We will speak about this later stage, but not in the beginning. By the way, let me give you some tip about draining comedones at the clinic. Sometimes comedones are far from the papules and pustules, and you can drain them safely without irritating the skin. For example, those comedones, you can drain them in the clinic. But sometimes comedones are like inside the papules and pustules. They are, when you press to drain the comedones, you will press the papule and you will cause stress, and stress is not good for the acne skin. So have a tip: you can drain some of the comedones that are far and in a not inflamed area, but do not drain the comedones which in all the conditions that will irritate the skin. You can wait a little bit with those comedones. All right, I tried to to write down, but okay, let's skip it. Let's clear it. Okay. So as I said before, we at the very beginning we will start and we'll dedicate all the treatment days to azelaic acid to treat the visible and let's say ugly acne, so we can progress and give a good result to our patient. So at the beginning we will use a daily or every other day, or maybe 5 times a week, but only azelaic acid at the beginning, okay? Then as we progress with the treatment, we will reach to a point when the acne is mostly cleared, not necessarily 100% completely cleared, but there will be a point that the skin is very close to balance. So I mean the existing papules and pustules, the remaining are very little and shrunk, and we have no appearance of other new papules. So this is the point that we can incorporate some treatment days with bright or lactophil, with the HA products, with the exfoliators, okay? So for example, at this point, we can have the patient use azelaic acid 3 times a day and 4 times a week, I'm sorry, 3 times a week, and 4 times a week, he could use bright or lactophil. And later on, as we proceed, it could be like 2 times a week azelaic acid and 5 times a week bright or lactophil. And later on, 1 time a week azelaic acid and 6 times a week HA exfoliator. So we change the proportion between azelaic acid and the HA exfoliator according to the skin condition. As we progress and balance the acne, we will need less azelaic acid days and more HA days. Okay, so let's have a look on some some acne conditions and see if we understood. So for example, with this boy, we have very mild acne and many comedones, okay? So we can decide, you know, it's not that there is one good protocol and other protocols are not correct. So this is a thing that we have to keep in mind. We can treat the same patient with several protocols and every one of them should be perfect. And even we get results in the same time. It's not that we have only one way to treat. So I will introduce, for example, 2 ways to treat this condition, okay? So for example, we could give this patient Azalite and Bright. For the first like 2 weeks, he should use Azalite every day. And then incorporate Bright into the treatment and like 2-3 days with Azalite and the rest of the days we could use Bright. This is one option because this is very mild acne. I predict that 2 weeks of Azalite will give us a very good progress. And then we won't need the Azalite very much. And we can, and we can give a protocol of 2-3 days of Azalite and rest of the days, because we have many comedones, to give him Bright, the patient. This is one way to address this case. And we can give another protocol that will be, for example, to give this patient Azalite Plus, which is not irritating, and Bright. And in the very beginning, it could be using at the same evening Bright, and after 20 minutes on top of it to apply Azalite Plus or AzoCare. Those are 2 products that are not irritating. AzoCare and Azalite Plus are not irritating, so they can be used at the same evening with Bright. And this will give us, by the way, even faster results. So for your decision, of course. Yeah. Okay. Now, sometimes or let's look at it like this. Those are 2 cases when we see very big comedones, very dominant, and very mild acne at the same time. So our big problem is, of course, the comedones. They are more prominent. So the treatment that we should give to this patient should be based mainly on HA exfoliants for home use. So those patients should be using, for example, Bright every evening, and after Bright they should apply like AzoCare. Because AzoCare is very, you know, this is mild acne. AzoCare is enough for this mild acne. So at the same evening, Bright, after 20 minutes, AzoCare. Or Azalite Plus, as you to decide. I want to remind you at this point, when you look at the pictures, the tip of double dose of HA exfoliator. Like for example, when we treat very big or deep comedones, and we have, let's say, dark skin patient, that because it's dark skin, we want to give lactophyll and not bright. Now, lactophyll is a gentle exfoliator. We should be concerned about whether lactophyll will be enough to treat the comedones because they're big or deep. So there is a thing, we call it double doses. What is a double dose? Double dose is the patient applies the HA exfoliator after 30 minutes, at the same evening, after 30 minutes or an hour, it can apply another application of this product. Now, it doesn't have to do it every day. It can do it like 3 times a week, but totally it will increase the depth of the peeling that we get. So it's better and more intensive for those kinds of comedones. So most of the time we do it with lactophyll because lactophyll is a gentle exfoliator, but sometimes we should decide to do it even with bright. Bright is a good exfoliator. Generally, we don't have to do it with the bright, but I leave it for the cosmetologist to decide when to when to use even bright in double doses, because technically it could be done with any exfoliator. And this is another condition when we see many comedones, and also at the same time, in the same patient, we see many fat concentrations, deep fat concentration. I know some of the cosmetologists call it white comedones. I don't necessarily call it white comedones because not of them are comedones and not necessarily can be removed by drainage. But either way, we are speaking about fat that is covered by many skin layers. So when they are covered by many skin layers, a regular exfoliant like bright or lactophyll will not reach the depth of the problem. So it won't be enough. They will be enough for the comedones, for the noir, for the black comedones, but not for the fat concentration. So in this patient, we have to mix the two kinds of products. We will give this patient bright and azellite. I would choose azellite because azellite is the more intensive and deepest, maybe irritating, but the most, we have to dig deeper. And the deeper we have to dig, the stronger product we need. When we have to dig deep, we should prefer azellite over azocare or azellite plus. So if I will finish the protocol, so we can give the same patient like 4 days with azellite and 3 days with bright. Or the opposite, 4 with the bright and 3 with azellite. Depends what you get more comedones or more fat concentrations. Okay, and this is also a case when we can combine from the very beginning azellite with bright, because we see some fat concentrations, and also we see texture problems like scars, like some comedones. So with texture problems like scars, comedones, and so, the best product is bright. And for the fat concentration, the best product is azelaic acid. We can combine them both. Because the fat concentrations are relatively deep, I will choose azellite and give, for example, 3 or 4 days a week azellite, and rest of the days to be using bright. And then, as we proceed, we monitor the patient and have some checkups, and we see how the skin responds. And according to this, we decide how many days a week he will use azellite and how many days bright, according to the progress and what we see at this point, at the checkup point. So we will proceed to the next topic, which is inflamed acne. So sometimes the patient come to our clinic and the skin itself is inflamed. It is inflamed acne. So I want to define what is inflamed acne, because it's not the medical definition. It's not necessary the medical definition. It's more a useful definition to be able to give the correct treatment. So when we define the inflamed acne or inflammation, we mean the skin itself in between the papules or pustules is red. So when the skin is red, or when we have red halos around the papules and pustules, those are the cases that we defined as inflamed acne. So actually inflammation is a condition that we see by the eyes. It's not, you look at the patient and you see the inflammation. Now the importance is because when we give an irritative product on irritated skin, on inflamed skin, we can aggravate the acne, we can worsen the acne. So we have to be very careful and give very delicate treatment to all of those patients that the skin is irritated and inflamed. I want to address a very important point. When I say inflammation, we set 4 degrees of inflammation. Inflammation grade 1 and 2, which are mild inflammation, and 3 and 4 are severe inflammation. And when I say inflammation, it's not the grades of the acne. It's not, we can have, for example, patient with mild acne, but inflammation. And in the other hand, we can look at aggressive acne with no inflammation. The inflammation is not a definition of the severity of the acne. It's the severity of the redness, okay? So we could look at the skin which is very red, but the acne itself is mild, it's superficial. Like in this picture, for example. Let's first have a look on some pictures to demonstrate what is inflammation level 1 and 2 and 3 and 4, because we have different protocols and we address them differently. So let's be able to recognize what is inflammation and what grade. So this, for example, is no inflammation. This is a regular acne with no inflammation. And now we're going to be looking at some cases that the inflammation is grade 1 or level 1. So this is one, for example. 1 is mild inflammation, right? So these cases. Those are level 2, a little bit more inflammation. Okay, and those are 3. This picture, actually, we saw it before, so it's a relatively severe inflammation with mild acne, superficial acne. So we see that the skin itself is very reddish in between the pimples. Okay, so this is 3. And those are 4, level 4 inflammation. Okay. So now let's speak about how we address these kinds of inflammation, because as I said, we have to give a gentle treatment whenever we have inflammation, as long as we have inflammation. And then when the inflammation will get down and relax, and become, we can get to the regular protocol. But as long as we have inflammation, we will give another protocol, a special protocol, which is more delicate. So let's first speak about inflammations level 1 and 2, which are easier to treat. So 1 and 2, if we were to treat them with AzoCare or Azolite Plus, they are not irritative products, so that's okay. You can give those products in the regular way, only to start gradually and carefully the treatment, not every day, but every other day, and to add to the treatment, cure and calming. Okay, but if we decided for whatever reason that we want to give Azolite, which is irritating product, to this inflamed skin, inflammation level 1 or 2, we can give Azolite, but not the regular way, but we call it a reverse procedure. Okay, we call the protocol reverse procedure. So let's have a look what is a reverse procedure. So reverse procedure is a way to use Azolite with less irritation or no irritation. So the stages are, we wash the face and then apply cure. Generally we don't apply cure, we apply on clean face azelaic acid. But in the reverse procedure, we apply firstly cure and not the azelaic acid. So we wash the face, apply cure, we let the cure be on the face for 30 minutes till 1 hour, something like this, to calm the skin. And after that, we apply half dose of Azolite, a half dose, not a full dose. And then after 15 minutes, up to 30 minutes, we apply calming in taps. This is very important, not to massage the calming, but to tap it on the skin in order not to mix it with the Azolite which lays below. So in inflammation grade 1, we do this treatment like 3 or 4 times a week, not every day at the beginning, 3-4 times a week. And we wait, before we put the calming, we wait 30 minutes. We let the azelaic acid be on the skin 30 minutes, and then put the calming. And grade 2 inflammation, which is a little bit more inflamed, more reddish. So we do the treatment only 2 to 3 times a week at the beginning. And we wait only 15 minutes before we put the calming. So the Azolite will be on the skin for 15 minutes only, and then we tap calming. Yeah, the reason is that we don't want to be the skin exposed to Azolite without the calming protection for more than 15 minutes because the skin is irritated. Now, during the treatment, the inflammation may improve and the skin may not be inflamed. When the skin is not inflamed, the treatment should be regular. No other procedure. Okay, normal treatment. Okay, now when we treat inflammation grade 3 and 4, that's a severe inflammation. So if it's 3 and 4, we do not use Azolite at all. Azolite is too irritative. In some cases of grade 3, we could use AzoCare. AzoCare is basically not irritating, but if we will put it on inflammation grade 3, there may be a little bit irritation, so cosmetologists should decide and consider and maybe use it for the first week, like once a week, and then 2 days a week, and of course to accompany the treatment with calming and cure. Okay, so let's talk about 2 topics. One is dehydrated skin. Sometimes the patient come to the clinic with dehydrated skin and do not mix it with the dry skin. It's not dry skin, it's actually the acne patient is oily skin. But he could be oily skin with dehydrated skin. So the moisture is compromised. And when we don't have enough moisturizing in the skin, some things happen. One of them is it compromises the penetration of the active ingredients. And 2, it compromises the activity of the ingredients. And 3, it can exacerbate the acne. So whenever the skin is dehydrated, we do not apply the active product like Bright or Lactofil or Azalite or Azocare. We do not apply them directly on the skin, but we first, after washing the skin with soap, of course, we apply very light moisturizer, let it like 10 minutes to be absorbed to the skin, and then we apply the active product. So it will be absorbed efficiently and give us the activity. Okay, so another very important topic when we use Azalite is to show the patient how to apply the products in order to prevent burns. Like Azalite is so irritating that if we applied it incorrectly, we can cause burns or red signs on the skin. Like you can see in on the pictures in the right side. So with this patient, for example, we can clearly see how she applied the Azalite. Like she took with the finger and applied spotly to every pimple, which is not correct. So whenever, I'm sorry, that was not the correct one, maybe this. Yeah, whenever we have an area with dense papules or pustules, we don't apply to each one of them. We apply a thin layer all over the affected area. A thin layer, this is very important because if it was a thick layer, they can cause burns. So thin layer all over the area, and to blur the borders of the application, to blur the borders, okay? Because in the borders, we have more cream, okay? Now, when we have like one pimple or two pimples that are very in a distance from one another, we can apply specifically on a pimple. We can do it, but it's important to show the client, the patient, how to do it. We have two ways to apply on a certain pimple. I'm looking for my applicator. I had an applicator here. Yeah, so one way is to take a little bit of Azalite, small amount, and to apply to this pimple very thin layer on the radius around, on the pimple, and the radius around like 1 centimeter, 1.5 around the pimple, and to blur the border. This is a safe way to give a little amount of azelaic acid without causing a burn. This is one way. And another way can be to take an applicator. You know, everyone have applicator at home, and to take a very tiny amount and to apply to the center of the pimple without exceeding the borders. So the pimple may be red, a lot of redness will occur, but later on, the pimple will heal and be cleared even fastly, okay? So this is another option that they can consider. Okay, now it's very important that when the client is at the clinic, we don't only speak and tell him what to do. After we explained how to apply Azalite, we should show it actually with the, for example, the cosmetologist can take a moisturizing cream, take a little bit of the cream and apply on one pimple of the client and show him how to do it. And when ask the client if he understood how to apply, and then whatever the application will be, whether it's a point application or general application, it doesn't matter. Each protocol, each way of application, the cosmetologist should show the client how to do it. So to show it with the, like, for example, moisturizing cream. And then when the client said, okay, I understood, cosmetologist should tell him, okay, now show me, what did you understand? And the client will take the moisturizing cream and choose some area, other area of the skin, and apply and show the cosmetologist. And this is the way to check whether he understood indeed, or he only thinks he understands. And this is the time to correct the mistakes. And whenever, when he managed to put it right and to apply it right, you can rest assured that the client understand and will be treat himself at home correctly and safely. And that's very important with azellite. It's very important to be safe and not cause burns, and also to get the results, of course. Okay, so let's speak now about the treatment areas. Sometimes the acne is not spread all over the face, but it's mainly on the forehead, for example, or only on the chin, or every now and then we have on the cheeks. Like I call it the face-like puzzle. Sometimes at the same with the same patient, we have several skin behaviors. For example, the chin can be very active, and the forehead can be completely balanced, no pimple, and the cheeks, every now and then, rarely, 1 or 2 pimples. It can happen, and the treatment should be adapted to the skin behavior in each and every area, okay? Now it's very important to listen to the patient, because it can be, for example, that the patient came to the clinic and we see pimples only on the chin area. But the patient may tell us that, yeah, I know now you see pimples only on my chin, but every now and then, even on my cheeks, I can see 1 or 2 pimples, even though now they are very not active, but it can happen. So we don't not only look at the patient, but we listen to the patient, and we see what the activity of the face really is, in order to correctly match the right protocol. So it's looking at the face and listening to the patient, okay? So for example, if the story, the case is that the chin is very active and the cheeks every now and then, now they are clear, but every now and then we see 1 or 2 pimples, and the forehead is balanced completely. So we will give the patient an intensive protocol for the chin area, preventing protocol for the cheeks area, and no treatment for the forehead. We don't have to treat balanced areas of the skin. We don't have to, okay? So if, for example, only the chin is active, so only the chin will be treated. This is a more, more friendly way to treat, and not to irritate all over the face area, not to dehydrate the face area, not to waste the cream. You use a very tiny amount of cream only for the active area. So this is more friendly and cheaper way of treatment, and easier way of treatment, and more accurate way of treatment when you address only the active areas. So let's have a look at some cases. This case and this case, it's located acne, only limited to only one specific area of the face. This, for example, is inflamed acne in a specific area of the face. And those are also examples of specific areas of the face that are infected. Okay, now when I said preventing treatment earlier, so if the area is active, we match intensive protocol, like every day. Maybe we should begin every other day and proceed to every day gradually. This is active treatment. What is preventing treatment? Preventing treatment is like when we have an area that every now and then we have acne. Maybe now we don't have acne, but it's prone to acne. So preventing treatment would be, for example, to use Azocare 2 or 3 times a week only, or Azellite Plus 2 times a week, or half dose of Azellite, half dose, not full dose, 2 times a week. So half dose 2 times a week is not intensive treatment, it's a preventing treatment in order to prevent acne. Okay? Let's look, for example, on this case. In this case, we have some pimples that are very far from one another. And I will use this case to demonstrate the combined protocol. What is combined protocol? It's combination of treatment days and prevention days a week. So for example, for this patient, we could give treatment days, like 4 treatment days a week, only for the pimples, which are very distant from one another. And the 3 remaining days will be preventing days. The preventing days should be for all over the active area. So for those pimples, we can apply azalite in full dose 4 times a week. And for all of the area, in order to prevent new pimples from popping up, we can apply half dose azalite 3 times a day. 3 times a week. Half dose, okay? And this can give us a quicker results if we, of course, if the cosmetologist decide to give another treatment, not the combination treatment, it can be okay. There's no one way to treat acne, but this combination treatment is very accurate and convenient. And 4 times a day, we don't irritate all of the cheek area, because the lesions are very apart from each other, very on a distance. So we don't want to irritate all over the week, all over the entire cheek area. So some days we are concentrating in the pimples, and some other days we prevent other ones from being formed. Okay? Okay. So now let's proceed to the next topic. Sometimes we see patients that during the acne treatment, we started our acne treatment. In some points, we start to see more clearly the scars and the red marks, and the acne is still active. We still have active acne, but we want to address and to treat also the post-acne red marks and the post-acne scars. So that's okay to treat them, but if we do it too soon, when the acne is still active, we can, and if we were to incorporate bright or lactofil to the treatment in order to deal with the post-acne, we may have a kind of regression. And because bright and lactofil are not good for active acne, they can cause stress if we use them too soon when the acne is still active. So we have to see what is the correct point that we can gradually incorporate bright or lactofil for the post-acne, but not to have regression because we started them too soon. Okay? Is it clear? So let me mute. Yeah. Okay. So when is the correct point? So as long as the skin is not balanced, we see new pimples. We see like fresh pimples, red pimples, and the new ones are popping up. It's not the correct time. The correct time will be when the skin is almost balanced. The existing and the remaining pimples are very little and shrunk and dry, and there is no appearance of new ones. So this can be a good point to incorporate some treatment days for the post-acne, for the red marks, for the acne scars. So when I say incorporate, I mean to give, for example, 2-3 days with bright, and the rest of the days the patient continue to use azalite or azelaic acid product because the acne is not really finished. And the more progress we have with the acne, we can lower the use of the azelaic acid and to give more intensive treatment with the bright or lactophyll. Okay, the proportion will vary according to the healing of the skin and to the balance of the skin. So let's look at some pictures, some cases of patients that were treated for acne, and the acne is almost gone, and we see now the remains of the acne. All of those conditions, those are patients that cosmetologists consulted us, BIOFOR specialists, BIOFOR training department, and the question was, can I give now a bright or lactophyll to treat the acne remains? Is this the right point? So all of those patients that we will look at are patients that we will discuss whether it's correct to start the post-acne treatment or it's too early. So this is one of the cases. This girl was treated for acne. The acne is almost gone. We see mainly the remains of the acne. So yes, in this case, we can give her protocol with like, for example, 1 day a week with azalite to continue and balance the skin, but all the remaining days, like 6 days a week, this patient can have a bright or lactophyll in order to treat the post-acne condition. This case, for example, is very interesting case when the left picture, May 2016, she came to the cosmetologist with this acne. She was treated for a month. In June 2016, she looks like in the right side of the picture. So in a month, she had a good progress, but in June 16, she was a month before her wedding. So the cosmetologist asked us, the trainees of BIOFOR, tell me, should I give this patient bright in order to get smoother skin for the wedding or not? So our advice was no, don't take any risk and introduce a new product to the skin a month before the wedding. We don't know how the skin will respond to a new product. So if she had such a good response to azalite, as we see, she responded very, very well to azalite, we prefer to continue the treatment with azalite for a month, for the upcoming months, and to get another good progress. And then the remains we can cover with makeup, but you know, you cannot cover with makeup pimples. You can cover like post-acne red marks, but you cannot cover pimples. So first, do not introduce a new product a month before wedding, and two, you have to see the progress that you have in this skin and the response. If the response is so good, maybe it's best to continue and balancing the acne and then address the post-acne. Okay, and this patient, for example, also the cosmetologist asked, should I apply bright or partly treatment with bright and continue treating the acne? So in this case, we think that it's too early to introduce bright to the treatment because this patient has still active acne. The cheek is slightly red. New papules are popping up, so it's too early. In this condition, it should be continuing using azalite for some more weeks or for the next period until you have more clearance and more balanced skin. Okay, this, for example, is a boy that was treated. You see the picture before, and after 2.5 months, he got progress. And in this point, the cosmetologist asked, should I give this boy a lactophyll for post-acne in combination with azellite in other days, of course. So the question is it ready now for exfoliator, home exfoliator? Yeah, clearly the after picture is not lighter skin. It's the ankle of the picture is Fitzpatrick 4 or even 4 to 5. It's more light in the picture. This is why it looks like is like brighter. It's not like brighter. This is a dark skin. So so some will say yes, it's ready for lactophyll in combination with azelaic acid. Some will say no, it's not ready. Actually, we cannot argue in this case because the two opinions are actually right. We can wait and give him some more azelaic acid treatment, and also we can equally decide to incorporate the lactophyll into the treatment and give like 2-3 days of lactophyll and rest of the days to continue with azelaic acid. Both approaches are okay. Why did I say lactophyll, by the way? Because lactophyll is for dark skin. So for this patient, we cannot give bright. We should give lactophyll, okay? Okay, so let's look at this patient. This is the two sides of the face of the same girl. That's the same girl, right side and left side. So the question was, can I give her bright for the post-acne scars and red marks? So we clearly see that she has many remains, many red marks and scars. No question that we have to address them and to treat them. Question is, what is the correct point? So in this case, we advised not to start with bright and to continue the treatment with azellite because the skin is not balanced and it's very, delicate and reddish and sensitive skin. So if we were to give her bright, maybe we could exacerbate the acne. So our opinion is to wait a little bit, to continue using azelaic acid, to have more clearance of the acne and more balance in the skin, and then to start using bright. Bright because she's fair skin, and bright is stronger than lactophyll. Okay, so let's look at this boy. This boy is lying down on the clinic. The cheek looks red, but it's red only because he had an exfoliation. It's not really reddish. So the question is, can we give him bright in combination with azelaic acid product to continue and balance the skin? So in this case also, we can already give bright to treat the texture. In combination, of course, with azelaic acid to continue and balancing the skin because the skin is not completely balanced, but is close to be balanced. So if, for example, this patient has at home azellite, the azellite product, these days it does not need full dose of azellite. It can apply half dose of azellite, like 2-3 times a week. If you have azocare, so that's okay. Azocare will be enough for this case. But if you have azellite, it doesn't necessarily have to use it in the full dose. It can use a half dose, and this would be enough for this case, okay? Because it's very mild and terminal acne. Okay. This girl, for example, this was another consultation from a cosmetologist. Same question, should we give this girl a bright in order to treat the texture after we almost completely balanced the acne? Those are the questions. Some cosmetologists will say, no, I will rather continue treating with azelaic acid. This can be okay. Some will say, yes, I will give her like 2 days a week of bright. This will be the start of the treatment with bright. This is also okay. There is no mistake. The two options are completely okay. Okay, now let's move to the next topic, which is treating acne in dark skin. So in dark skin, specifically especially in the very dark skin, like Fitzpatrick 5 and 6, but also in 4, sometimes every new pimple, when it cures, it leaves a brown mark because the skin is very susceptible for pigmentation and can easily develop pigmentation. And sometimes the pigmentation is so prominent and so dominant that we want to treat all of the phenomena, the pimples and the pigmentation at the same time, like to give azalite and cure and calming and skin tone and lactophyll at the same time. So that's not efficient, and that would not work. That cannot work. It's too many products, and it's not effective it's also very complicated and very expensive, but it's not the correct way clinically to address these conditions. So the best strategy will be to firstly address the acne, the active acne, and to clear it and to balance and normalize the skin behavior as soon as we can, and as faster as we can, with azelaic acid and cure and calming, to use all the soldiers for this war. This is because the skin is very prone to pigmentation, because if we won't address fast enough the behavior of the skin, we will be always chasing new pimples, and new pimples for this patient is new dark spots. So we have to first balance the skin to normalize the skin behavior, to prevent new pimples from be created. And this is how we prevent new pigmentation from being created. So we will use all of the good products that we need, cure, calming, and azelaic acid product. All of the treatment days will be dedicated to the acne treatment. We want to solve it as quickly as we can. And then when we even are close to balancing the skin, we can incorporate lactic acid, we can incorporate lactophyll into the treatment, and on top of it, skin tone. In other days will be azelaic acid, also with skin tone. We can put azelaic acid and on top of it, skin tone. Okay? And also let's remember that azelaic acid also improves pigmentation. So we don't really delay the pigmentation treatment. We already start the pigmentation treatment by azelaic acid, and later on we will enhance the pigmentation treatment with lactophyll and skin tone. Okay, so this was for the dark skin. And also another advice, when we have comedones in dark skin, let's say it's only comedones or papules and comedones, don't start and drain the comedones without preparation. Preparation will be at least 2 weeks before draining comedones, before the first treatment of draining comedones, to use lactophyll. If you use lactophyll 2 weeks before the drainage, and of course continue using lactophyll, the drainage itself will be less stressful. You know, we wish to avoid any stress condition to the dark skin, because stress causes pigmentation. Okay, yeah. So let's now review the acne types from the most easier condition to the worst condition, and see how we treat all of the acne types. We will start with actually number 1 is not acne, it's oily skin with no acne. So how do we treat oily skin? So for oily skin, although it's not acne, it's also doesn't necessarily look pleasant, and many people with oily skin doesn't want to look like this, to look shiny, from the wrong reasons. So for oily skin, we can give any component that controls sebum production. For example, azelaic acid controls sebum production. Also retinol controls sebum production. So if it's a young patient, we can give Azocare. or we can give a half dose of azellite 2-3 times a week, not necessarily every day. It's not a pathology, it's not acne skin. So a slight treatment with a half dose azelaic acid or azocare. Azellite is not really needed. It's also irritating, so I would choose azocare. Or if it's aging skin, or if the patient wants also to rejuvenate the skin, we should give Renew because it contains retinol. Number 2, if the dominant phenomena is comedones, so we have a lot of comedones. I'm sorry, number 2 is only comedones. So if we have only comedones, that's simple, bright or lactophil. Bright if the patient is fair skin, and lactophil if it's a dark skin. And number 3, when the dominant phenomena is comedones, many comedones, and 2 or 3 papules. So the main thing is comedone, we give bright or lactophil, and we can locally treat the papules with the azellite or azellite plus, or maybe azocare. We could use, for example, everyday bright, and on top of the bright, on the affected areas, we can put the azocare or azellite plus. If this is if it's azellite product, so it's not in the same day with bright because it's too irritative. So we can give, for example, 2 days with azellite, and the rest of the days will be with the bright. So number 4, when we have very, very young patients with acne, like 9 years old, 10, 12 years old, the skin is very delicate, and this is a kid. So we can use azocare, it's a very good option, or azellite 2-3 times a week. Azocare, azellite plus, sorry, 2-3 times a week. Azocare can be used like even 5 times a week or every day. And if it's azellite, we can use it in a half dose, and not every day. For gentle treatment, bottom line. So number 5, superficial acne. We can use azocare. It's a very good treatment for superficial acne. We can decide on also for Dermapil, if it's not irritative or red, because if it's red skin, Dermapil could irritate the skin because of the alcohol. So pick azocare. Okay, if we're treating the back area, so the back area is very not sensitive and very thick, and the penetration is a little bit compromised because the product cannot penetrate easily to the back area. And the fact that it's not sensitive is good for us because we can go for the azellite product. Azellite actually is the most effective product for treating the back area. Not azocare, even not azellite plus, we should use azellite. It penetrates very quickly and well. And also the back area can tolerate this product. It can be used every day, even spotly with the finger. We can put it spotly with the finger on the back area, or also the buttocks, not only the back. Okay, hormonal acne. So azelaic acid is actually very suited and very good for hormonal acne because azelaic acid acts in a hormonal mechanism of action. It can balance the testosterone and estrogen responses in the skin, okay? So in hormonal acne, azelaic acid product could be the only product to treat the acne. Of course, if it's hormonal acne and inflamed, we should use also a calming, maybe cure, but if it's not inflamed, we can give only azelaic acid product and it will be perfect solution. Okay, and when we have severe acne or aggressive acne, we use all our tools. We use azelite and cure and calming in order to be getting faster and better results. Now, let's look at some cases of subcutaneous fat concentrations. Those, for example, most of them are covered by many layers of skin. So in all of the cases that they are covered, HA exfoliator would not be enough. Sometimes some of them are a little bit exposed and white, and and those could be addressed with the bright or lactophyll, but most of the cases that we see, they are covered by many layers of the skin. So a superficial exfoliator like bright or lactophyll would not be enough and would not treat the root problem. So azelaic acid, for example, actually treats the root problem because it normalizes the amount of the sebum that the skin produces, and also it normalizes the skin, the rows of the skin cells that are formed inside the skin. So we don't have this condition. So azelaic acid is a very good solution for this, for those cases. So the deeper the lesion is, or the more covered, the more we will prefer Azalite over Azocare or Azalite Plus. Azocare and Azalite Plus would not be enough for the very covered lesions, okay? Okay, in this case, for example, is a 14-year-old girl, and she's very young, and we advise her, or the cosmetologist, to give her either Azalite or even Renew. Even Renew, because Renew contains retinol, and it's also controlling the skin cells turnover and the sebum production. Okay, and in this case, for example, we can see many fat concentrations, very, very mild acne, and some comedones, of course. So I should advise to start with azelaic acid, which will control the sebum production, all the fat concentration, and the mild acne. And maybe in like 2-3 weeks, we can combine also a bright for the comedones. Also, at the very beginning, the cosmetologist can drain the comedones because it's not irritating for the skin to drain them at the very beginning. This could be done. So as we proceed, we incorporate bright to the treatment, and the question is how many days with bright, how many days with azelaic. So it's depending on the skin condition. If we have more fat concentration in acne, we should give more treatment days with azelaic acid. If we have more comedones, so more treatment days with bright. It depends. Okay. Now let's speak about preservative treatment. After the acne is cleared, we have no pimples. Let's speak about a preservative, or let's call it a preventing treatment. So when the acne is cleared, we don't skip the treatment at one time, because maybe the acne is cleared, but the genetics is not cleared. So the acne patient is still prone to develop acne. The reason that we don't see active acne is because he got treatment. He got some azelaic acid and so on. But if we were to stop using at once all of the products, it can get a kind of regression, okay? So how do we manage the treatment so that we don't have relapse, okay? So for example, the acne is cleared and the patient have at home still have the Azalite product. So we can give him a Azalite by half dose, not a full dose, for 2 times a week for 3 such weeks. And we check up. We have him to the clinic or check up with photos that he sends us. And if we see that the skin is still balanced, it remains balanced and no new pimples, we can change the protocol to half dose 1 time a week for 3 weeks, more 3 weeks. And then we check up, we review, and if the skin is still balanced and no new pimples, we can give him a half dose Azalite for once in 2 weeks for 3 more such times. And then after that, if the skin is still balanced, no new pimples, he can skip the treatment. We can know that the skin is okay and balanced, okay? So when the treatment, when we stop completely the treatment, we should tell the patient that now is not, we don't follow up. So if there is any slight change on the skin condition, if you have new pimples, Don't wait till you will be covered with the new pimples. If there is a slight change, call me and let me handle it at the very beginning. And with comedones, it's the same principle. We don't stop at once the treatment, even if the patient does not have any comedone, still you have the tendency. So we don't stop the bright or the lactophyll at once. We leave some treatment days a week for the next period and do the follow-up and see when we really can stop the treatment. Okay, so let's speak a little bit about acne scars. So to treat acne scars, we actually need exfoliator, a good exfoliator. So if it's like recent scars, fresh, mild scars, we could use bright or lactophyll. But if it's severe or deep scars or old scars, old are 2 years and above. Okay, this is a prominent scar. This is a fixed scar. And so 2 years and more, this considered to be old scar. So we treat with Renew. The reason is because Renew is exfoliating deeper than bright or lactophyll. So we will see now some case studies. And I advised every participant to look carefully into the skin and to describe to himself or herself, what do I see? What's the dominant problem? What ingredients or products will resolve the problem? And what will be the protocol, like every day, to begin every day, maybe to begin gradually and to go to every day, half does or full does, which products? So let's look at some case studies. I will be happy if I can get some suggestions from the participant for a protocol. They also can write it down in the chat box. So they will write it and Lada will translate. So maybe some of the participants would like to give me a suggestion for protocol for this boy. And maybe you will look at the chat box to see if we got some protocols.
So we have bright, white, dermapil, and soapless soap.
Okay, great. So a combination of bright and azalite, I agree. And the question is why dermapil? So, because I, for example, in this condition, won't give necessary dermapil. Dermapil works superficially, and we see here fat concentration and texture problems that responds well to a bright and azalite. I agree. Combination of bright and azalite. I won't necessarily give bright, and soapless soap. That's correct in any case.
Yes, because salicylic acid could help with hyperkeratosis.
Yeah, but I want to remind you that bright also contains salicylic acid.
So Elizabeth says that we can combine bright and azalite. So azalite 3 times per week and combine it with bright in evenings, and in mornings we can use calming and cure.
So for the evening, I agree, perfect. For the morning, cure is okay. Calming, I don't see why, because maybe it looks reddish, but it's not really red. The skin is not red. It's effect of the photographing, and it is in the clinic now. So if the skin is red, I agree, but the skin is not really red, so we can skip the calming. Also, to use calming in the morning, it's not so convenient. This is a boy that has to go to school. And if it's a mature patient, he has to go to work. So we don't really, it's not really realistic to put calming in the morning. You have to put it when you're at home, not when you need to go out. That's another concern. Okay, So let's have a look on another case. This is the back with acne, a girl with the acne in the back. What do they suggest? Okay, what will be the protocol? How many times a day to fully apply or spotly apply? Whether it's every evening, every other evening, what will be the protocol?
So Anna says azolite locally on the lesions, yes, on the affected areas, 3-4 times per week, and 3 times a thin layer on all the area, okay, of the back.
So that was important to do this discussion because this combined protocol, when we do days of local treatment to the lesions and days of even application, this is only suitable for cases when the lesions are very dense from one another, very apart from one another. Here, in this case, we have relatively dense pimples. They are close to one another. So we can't really spot everyone separately, okay? In this case, the best way to treat is to apply evenly all over the affected area. So I want to demonstrate all over the affected area, a layer. We can put like moderate layer all of the affected area, not spotly, because they are very dense, you know. Okay, but when you have another back area,
So the person says Dermapil, azolite, and calming.
and Dermapil, azolite, and calming. In what protocol?
So Elena says Dermapil and azolite in the morning, calming in the evening.
Azolite and Dermapil cannot be used in the morning time whatsoever. There are products that we can use them only in the evening. Now, Dermapil with the active acne and the severe acne is not efficient. Actually, we don't need the Dermapil. Azolite is a good solution for the back area, but I want to suggest here in this condition to use the combination treatment. Because if we look at this case, we can see many scars, but we can see few papules and pustules, and many scars. So we have a large area which is only post acne not scars, red marks. Okay, not only the back area is actually pimples. In most of the back area, actually, it's red marks. So in this case, we can give combination treatment that for 4 days a week. 4 days a week, maybe I will write it down. 4 days a week, we can treat it spotly. Of course, they will need help. We can treat it spotly. And the other 3 days a week, it can treat all over the back area with a even layer all over the back. So in those days that you will get the point treatment, that this is more effective treatment, because when you take azelaic acid with your finger and put on the pimple, it digs deeper in the skin, and the lesion will heal more quickly. So 4 days for this quickly treatment, and 3 days for the general treatment for all over the back area in order to prevent. Okay, let's clear it and move on. Okay, so let's have a look. This, for example, is a boy with a little bit inflammation, not severe inflammation, like grade 1, I think. So what can be the protocol?
So the person says reversed protocol, reversed treatment.
Yeah, I agree. So reverse, if we use azolite, it will be reverse protocol. If it will be azocare or azolite plus, we don't need reverse protocol. We treat him in the regular way. Okay. Okay. Let's have a look in this patient. This is a very dark patient. By the way, when we have very dark skin, sometimes we don't see the inflammation like redness. We don't see redness because the skin is dark. So the red and blood vessels does not seem red, but we have to look careful because they're still there.
So skin tone, cure, azocare, and calming.
I'm writing down skin tone, azocare, calming, and
cure.
Cure. Okay. Cure and calming are necessary. Azocare would not be enough, I think, for this severe acne. This is a severe acne. So I won't choose azocare. I would choose a stronger product like azolite plus or even azolite. Okay? Azocare, it's not enough for this patient. And also skin tone, not for this stage. Skin tone will be added later. Also, it's very complicated to add skin tone at this point in the beginning of the treatment because we have many layers of application, many stages, and the patient could get lost with all of the application. This is why we firstly address the active acne, and then we can add the skin tone at the beginning, when the treatment proceeds a little bit and the face is more balanced. Okay, let's look at this girl. So pay attention, this girl, it's the two sides of the same girl, two sides of the face, left and right side of the same girl. So pay attention, we see we see difference in the activity of the left side and the right side. One is more active, one is more quiet.
Cure, bright as a light with applicator. And also another person says, we will conduct the treatment for some of the sites with different protocols.
We clearly have to give different protocols from both sides, clearly, because they're not behaving the same. Okay?
So another person says, Elena, azocare, and Anne says azolite plus.
Okay, so let's first address the first suggestion and then the second and the third. The first said cure and bright and azolite with applicator.
Yes.
For the both sides or for one side?
Azolite for one. Azolite just for acne, the person says.
And the bright for the other side?
No, she didn't say bright. Azolite is just for acne.
Okay, azolite for the acne with applicator, she said?
So she says bright and cure for the second site. Yes, azellite with applicator.
I see. Okay, so I agree we have to give this girl 2 protocols. This I agree. Also, I agree that the balanced side can get bright. That's okay. With the azellite with applicator, in this case, in this spread of the lesion, we don't need applicator because they are close to one another. So it's preferably to apply the azellite not with applicator, but all over the affected area, which you could, for example, do like 3-4 times a week to apply a thin layer to the affected area, and some other 3 days with the half dose to all of the area for prevention. This could be a good way to use azellite, but not spotly. Not spotly because the lesions are very close to one another, and this is not logic to apply spotly. And the other suggestion was azellite plus and azocare. They are all good. Azocare can be enough for this acne because it's superficial acne, it's mild acne. Also, azellite plus can be enough for this acne. We don't necessarily have to go to azellite, which is irritating. We can give a more gentle and convenient treatment by azocare or azellite. And of course, the affected side should not be treated the same as the balanced side. So in the balanced side, maybe azocare once a week to prevent. But in the active side, it will be active treatment. Let's have a look on this case.
So one person says that we have the inflammation of the 3rd degree, and the other person said we need cure, calming, and azocare.
I agree. First, I agree that we have inflammation, maybe even 3rd degree, I agree. So we have to give very gentle treatment with the azocare, not more, not the azellite plus, not azellite. I agree also. And even cosmetologists can decide to give for 2 weeks, for the 2 first week, only cure and calming, and then to start the treatment. Not necessarily, she can't treat at the very beginning with azocare, but she can also wait and give calming and cure, and then incorporate the azocare. Either way, this is a good treatment.
Okay, and the other person says azellite half the dose and 3-4 times a week and plus cure.
This can be good but not for the very beginning, because what we see is inflammation. So I prefer first to lower the degree of inflammation to calm the skin, and then we can slowly and carefully incorporate a half dose of azellite. Like the first week, 1 application, and then 2 application next week, and 3 application, and upgrade. Okay, we have to be very careful in this case because it's not a severe acne, but it's very sensitive and inflamed.
Отже, я б не рекомендувала такі протоколи з самого початку, тому що ми спочатку маємо знизити запалення, так, маємо пом'якшити, заспокоїти шкіру. Тому я б запропонувала дуже повільно вводити половинну дозу азелайт. Тобто в якийсь там тиждень 1 раз, в наступний тиждень вже 2 рази і в наступний тиждень 3 рази половинну дозу азелайт.
Okay, good. So let's have a look let's have a look at this boy. So pay attention, the forehead is more active than the cheeks. So maybe we should give a separate protocol for the forehead and another protocol for the chicks.
So Anna says azolite on the forehead every day.
Okay. And for the cheek area?
And continuous 2-3 times a day. Oh, sorry, a week.
For the cheeks or for the forehead?
So also another person says, Anna says it's for the cheeks. Yes, for the cheeks.
Okay.
And she says for the forehead every day.
Yeah, I agree, but let's speak with the Anna about Anna protocol and then proceed to other protocols. Okay. This is Anna, right?
Yes.
So I agree that for the forehead we should use azolite every day, and for the cheeks less days a week, even twice a week. She doesn't need even 3 times a week. She could give 2 times a week, half dose of azolite, because it's merely to no acne. It's not serious at all. So we could give for the cheek area 2 times, half dose azolite, and every day for the forehead. But when you start treating the forehead, not to start with every day on the first week. On the first week, we have every other day or something like that. And then gradually we proceed to every week. Okay.
Okay. We have another treatment. So Elena says renew for the forehead, bright and azolite 3-4 times per week.
So azolite 3-4 times, and other nights we renew?
Renew for the forehead, she says bright, and azolite 3-4 times per week. I'm not sure whether she said it for forehead or for the cheeks. I'm not sure. She didn't say. She just said this.
So
there's a bright and azolite for the cheeks. Okay.
Okay. Bright and azolite for the cheeks, I could agree, because bright is for the texture and azolite for the other things. But for the cheeks, it's important to me to stress we don't need a full dose of azolite. Half dose would be enough. We also do not want to irritate the skin, you know. So when not necessary to use a full dose, we give half dose. So some days with half dose azolite and some days with bright will be okay for the cheek. For the forehead, I won't give renew, because renew can irritate the skin and exacerbate the acne. I won't use renew, I would use the azolite for the forehead.
Окей. Отже, щодо щік, потрібно використовувати не повну дозу, а половинну дозу азолайта. І можна використовувати якісь дні брайт, а якісь дні азолайт. Це для щік. Якщо ми говоримо про чоло, то я б не використовувала ренью, тому що воно трошки подразнює шкіру, а тут ми маємо акне, і тому краще утриматись від нього.
Okay. Let's have a look on this condition. Actually, we could give many protocols for this condition. Many of them can be okay. So let's try.
So Anna says we need exfoliators, lactophyll, and combine it with azolite.
Okay, that's a good idea. Lactophyll with azolite in separate evenings, she said?
She didn't say. Yes. So she said it in separate evenings, yes, to combine it.
That's a good one. Any more suggestions?
So no more suggestions.
Okay, so we can do several good protocols in here. For example, instead of lactophyll, we could use bright also.
We have a suggestion. So one person says bright and azolite and sometimes calming.
Perfect. Perfect. This is what I was beginning to say. Instead of lactophil and azalite, we could use bright and azalite. That's a good one also. Also, we could give bright the first layer and then to apply in the same evening azocare at the same evening. Okay. Yeah, many ways actually. Okay. So.
So some person says azocare we can combine with bright.
Yeah, sure. Perfect. Perfect. So let's take this one for example.
Azalite plus.
Azalite plus. Okay, that's a good idea. Okay, for all over the face. Actually, yes, because we see pimples and fat concentrations. That's good. Okay. Another suggestions? Bright and azalite plus. So I want to remind that bright is a good exfoliator, but when we have fat concentrations that are covered with the, with some layers of skin, bright will not be effective. So bright is good for texture problems, for comedones, like regular comedones, black comedones, and texture problems and scars. But we have, in this case, we have active acne and many fat concentrations. And those respond optimally to azelaic acid. The most correct ingredient will be azelaic acid. Right, later on, if we want to later on to treat the texture, although she have very delicate and good skin, but bright is not for this point. I want to advise to use it in this point. Yeah, I want to say something. Azalite plus is very good. Maybe later on, as we proceed with the treatment, there will be necessary to add, to switch it with azalite, because azalite digs deeper in the skin. So it's very good to start with azalite plus. It's a gentler product, but later on, maybe azalite plus won't be enough for the stubborn fat points that we see, because we have many of them. Some are deep. So maybe later on, we should switch it to azalite. We should see the progress, Okay. Let's have a look on this boy.
The person says azalite, and
yeah, I agree. Also, by the way, we see that it tends to develop a very big acne lesions, like in this and this, for example, which are big. They require even pointly application. So we could apply azalite in a thin layer all over the face, and then add to these two pimples, take applicator, and in addition, apply to these two big papules more azalite, because they are very big. They are extremely big and they require very intensive treatment. Okay. Let's have a look on this girl.
So Elena says cure and calming.
And this will be it. No azelaic acid and treatment.
After 2 weeks, also as of care.
Good. That's good. That's okay. So I agree. She needs cure and calming because the skin is irritated. And azocare is a good suggestion, because azocare is good for superficial acne, and this is not severe acne. The skin is sensitive. That's perfect. Yeah. So that's a good option. Another option is to start from the very beginning with cure, calming, and azocare. Not to wait 2 weeks, but in the very beginning. That's okay, because azocare is suitable for this case. It won't be, it won't be irritative. Okay. But if we decided to do this, not at the very beginning every day or every night. So we start with like 3 nights and we proceed, okay, gradually. Okay. Let's have a look on some other, let's see for this girl, what do we think we can get her, which protocol, which product and which protocol?
So Anna says, because there's no inflammation, we can instantly apply the full dose of azolite locally.
Yeah, I agree.
Azolite also.
Yeah, that's good, I agree. Azolite to all of the area, right?
She says locally.
So every day locally, or some days locally and some days generally?
So Elena says on the full area.
So if we treat every day the full area, that's a good protocol. Otherwise, you can do 2 kinds of treatment, like 4 times, like 4 times a week. This will be 3, and this will be 4. Like 4 times a week only to the spots, 3 times a week, generally to prevent any new pimples. So this could be a good protocol. But you said before, application of azolite to all of the area, this is also good. This is also good.
And also we have one more suggestion. The person says locally 3-4 days a week, the full dose and half the dose on the full face to prevent 3 days a week.
Perfect. Perfect. Okay, good. Let's look at this girl.
So reversed protocol, and the other person says azocare. Sorry, azocare.
Yeah, azocare like alone, or maybe some other products.
So moisturizing and the calming mask the first 2 weeks, and then introduce azocare. And another person says calming.
Yeah, so I agree that the first 2 weeks we should calm the skin without azelaic acid, and then we should introduce azocare, not azolite, not azolite plus. We prefer azocare because it's mild acne. Okay, so I agree, and cure is okay, and preferably to use calming also. Calming will be very, very useful for this condition. Okay. Yeah, so let's see if we see some interesting cases. Let's look at this back.
So the person says dermapil, Elena.
Actually, dermapil is not very efficient for the back area because dermapil works superficially, and the back area needs a deep action.
So Anna says azolite locally.
Yeah, I agree. I agree because the pimples are very separated and far from each other. So, and the back is a big area. So it would waste a lot of cream. So yeah, we could treat locally with azolite, and maybe once a week we could apply to, or twice a week we could apply to all the back area for prevention, because we want to control all the acne skin and to prevent other new ones. Also, later on, when we control the acne, we can consider lightening the skin because we have here a pigmentation. This client tends to create pigmentation. He have already pigmentation. But first, we will concentrate in healing the back area and clearing the acne. And later on, we could give him for the back area a brightened skin tone to treat if he's concerned, of course. If it doesn't bother, so no, not necessary. But he have some dark spots.
Лікувати пігментацію.
So let's take this as the last case we discussed today, because we have a booklet with like 50 cases and also solutions. So every cosmetologist could get from Eugene and Elena the full booklet. We have it in Russia, not in Ukraine. I hope you will manage with it. And we have more cases, so they can later on read the cases, look at the cases and read. And before they get to the solution, I advise everyone to first write down what will be their protocol be, and to think about protocol, to write it down, and then to compare to our suggestions, and that's how they can see if they are in the right direction, okay? So maybe you translate this.
Yeah, so Ukrainian version is in Telegram group and everybody can access it.
Yeah, but also, Eugene, we have some last version with all of the 50 case studies. I advise you make sure you get the last version. We completed it like a month ago, the Russian version, which is more complete and with the more cases.
Okay, the one we have is 53 pages.
I don't know by pages, but I will ask Sharon if you have the last version, okay?
Yeah, thank you.
Yeah, welcome. So let's take this case as the last case for today. So first I want to say that I got good answers generally, so that's good. Okay, so let's have a look on this girl. What do we want to give her?
So Elena says lactophyll and azalite.
Azalite, I agree. Why lactophyll at this point?
She says because it's a light exfoliator.
Yeah, it's a light exfoliator, but now we're dealing with acne, with very active acne, very spread acne all over the face. And in this condition, lactophyll or bright won't help us at all, because when the problem is acne, the solution is azelaic acid, not HA exfoliator. So another answer?
Calming, the mask, yes, the mask, and azalite for the full area.
Yeah, so right, we see here acne that is spread all over the face area. Indeed, we don't see any little area that is not affected, even the nose. So it's all over the face, and hence we have to treat all over the face. I agree with azalite. Azalite is a good suggestion. Because we don't want to irritate the skin, we should build a very gradual protocol and not to begin from the very first day, every night with a full dose azalite, because this could irritate. So for example, we could give for the first week 3 times a week, half dose azalite, and then 3 times a week, full dose azalite, and then 4 and 5 times a week, to gradually proceed to more intensive protocol. But to start it very gently, because all over the face is covered with acne. Okay, so I think for today.
Yeah, I'm sorry, but there's one idea in the chat. So the person says as a cure. What does she say? As a light 50 and 50 pure.
To mix azalite with the cure. That can be okay, actually. That can work. Take into a consideration when you consider that when you do this, this is actually half dose of azolite and half dose of cure. So you don't get the full activity of cure, not the full activity of azolite, but technically you could do it, and later on you can spread them and you can separate them. Okay, so I will stop the sharing and arrange the camera. So first, thank you very much. You're perfect.
Ronit, we also had some questions posted in the chat during the session, so we might want to go through those questions. Okay, and we're proceeding to the questions from the audience.
So the first question is, I've used hydro cream and it forms like small pills. You know what I mean, yes?
Small film on the skin?
Small pills, like the small balls, basically, like when you apply the cream, you see the small pieces of the cream.
Yeah, maybe if I can get the batch of this product, because we had a certain batch of with this condition. If it's this certain batch, so we don't have any more this problem, okay? And of course, if you want to give back to Eugene, we will give another one, a good one. It's not compromising the cream, by the way. It's less convenient, but it's not compromising the cream. By the way, if she mentioned hydro, maybe we should remind hydro because we didn't speak about it. But whenever the acne is gone and we want to continue and to control the skin behavior and to prevent a relapse with the acne, we can give hydro as the moisturizing cream. Like cure is not efficient after the acne is gone. Cure is for existing acne. When the acne is cleared, a hydro is a good solution.
Okay, so the question is, when we have a combined protocol with bright and azolite, do we have to use, let's say, bright 3 times, so 3 days each day after the one which was before, or we have to do it like interchangeably? Yes, how we combine them?
Yeah, so because azolite is very irritating, you cannot use azolite at the same evening when you apply bright. So it always will go separately, always.
The question was like, let's say you have 3 days when you use bright, so and they go one after another, or we should change it. So one evening bright and the next evening.
I understood.
Okay.
I understood. Well, it's not really a big difference if you do it continuously, like bright, azolite. It's not really a big difference. We suggest to interchange, like one evening from this and one evening from that. But it's not indeed a big difference.
So Ronit, can you please look at the case in the chat, because there's a picture in the chat that you can look at. And so the person says stop inflammation after peeling. So it's an interesting case.
And this inflammation, let me see. Okay, this inflammation happened after azopil or biopil?
So this inflammation was after the peeling, but from other brand. So the products was from other brand.
Okay.
And the patient wants a protocol for this condition, you know, from BIOFOR.
Yeah. So another question I have to ask: did the patient come like this to the clinic, or it happened in the very same day that she took the picture? Like she did the peeling, and this was the redness, and she took a picture, or that the patient came to the clinic like this?
Yeah, so the redness was after the peeling itself. The patient didn't come like this. It happened after the peeling. Yes.
Yeah, okay. So if the redness happened after the peeling, that's not serious condition. I know she's very red. The skin looks very irritative and poor and like a little bit crying even because she a little bit suffered, but it could be calmed. It's okay. I assume with the good treatment, like she needs calming. Clearly, she needs calming for like 10-15 minutes at the clinic and then to home treatment, and at home to apply calming as long as she can. The more the better, to go to sleep with calming, to stay at home with calming, and this will go away. It's not, it happens after peeling. But clearly, if she as long as she's this red at home, we cannot give her not Azalite and not Azalite Plus, even not Azocare. As long as she's such red skin, we should only calm the skin and not proceed with the acne treatment until the skin gets calmed and less red. It could be red, but not this red. And then we gradually can start with Azocare. I see in the chat box, cosmetologist prescribed Azalite to the patient who stopped using isotretinoin 3 weeks ago. It was that reaction of the skin. So that's a very important point. You want to translate?
Yes, in Ukrainian.
Yeah, so after isotretinoin, the Roacutan pill, I assume it's the pill, right? So if it's the Roacutan pill, after a course of treatment, the skin is very, very sensitive, even a little bit like broken and dry, and it needs first a recovery treatment for several 2-3 months, and then gradually to be given Azalite if needed. Okay, otherwise this could be a reaction because the skin is very fragile after isotretinoin. Okay, that was a very good picture, what we received now with the, I assume this is an incorrect application of Azalite, what we see there, right?
Yes, after isotretinoin 3 weeks ago.
She was using isotretinoin and applied azelaic acid. So this could be one of the consequences. You have to be very, very careful with all of the patients that got isotretinoin in pills, and to remember that the skin is very fragile, dry, and dehydrated, and it should be recovered for some times before proceeding to application of azelaic acid.
Mm-hmm. So how to treat steroid acne?
Okay, this is a very aggressive acne, so it should be treated very gently and carefully, and even it depends. You have to decide what the degree of inflammation. If it's inflamed acne, decide what is the degree of inflammation, and according to the degree, start the procedure. Don't hesitate to treat it. It could be treated very well, but gradually and very carefully, because the skin is like a storm.
So the question is, can we compare the effect of the half dose of Azalite as compared to the effect of Azalite Plus?
That's a very good question. Excellent question.
Mm-hmm.
Okay. So Azalite by half dose, although it's a half dose, it digs deeper than Azalite Plus. It goes deeper. So whenever we have a condition that we want to dig deeper, like fat concentrations that are covered with many layers of skin, like severe acne, deep acne, cysts, we should use Azalite. Maybe we start with half dose, so the skin can tolerate, and then to proceed to a full DAS. Azellite Plus is digging less deeper than half DAS Azellite, but it's very good treatment to conditions that are moderate acne, even mild to moderate acne, also to irritative skin. Like if it's irritative skin, it's best to give Azellite Plus, which is not irritating and very good, over half DAS Azellite, because half DAS Azellite irritates a little bit also. Also, half DAS of Azellite Plus, we will get more anti-inflammatory effects, because 20% azelaic acid, you know, azelaic acid has anti-inflammatory effect. So half DAS Azellite, 10% Azellite. Also, when we use half DAS Azellite, we have the advantage that we can intensify the treatment, go up and up to a full DAS. And a full DAS Azellite is very intensive and you know, deep and fast treatment. So when we know from the very beginning that we want to go to the deepest and most intensive outcome and most intensive peeling, we can start with half DAS Azellite and go up to a 1 DAS. But with the Azellite Plus, we will reach to some intensive treatment, but not as Azellite. But still, if we compare Azellite and Azellite Plus, Azellite Plus have niacinamide. And niacinamide is very anti-inflammatory and very soothing the skin with acne. So if we want to emphasize the anti-inflammatory and the balance of the acne skin, Azellite Plus is very good at this. If we have inflammation, if we have irritation, you know, so Azellite Plus is very good at this. I know it can confuse. I know it can be confusing. Sometimes Azellite Plus and half DAS Azellite are both good solutions. Not one of them is better than the other. Sometimes it's they are both good protocol. Okay.
So the question is about the patients who are very young, 8, 9 years old. Can we use only Azocare, calming mask and purification for them, or maybe we can use other products with azelaic acid, like Azellite in some cases? Is it possible?
Yeah, so for the young patients, as we saw earlier, when I reviewed all the acne types, so for the very young acne patients, Azocare should be enough.
So can we use purifying gels and masks for these patients?
I don't know what is purifying gels or masks. If you will tell me what they contain, what ingredients, I could advise. I don't know what it should contain, but you can decide for yourself if they are not irritating, if they also only calm the skin and hydrate the skin. So that's good.
So the question is, can you use purification from the BIOFOR brand and also calming skin mask for the patients of this age?
What do you mean by purification with BIOFOR brand? What brand? What products exactly? Like Gentle Clean? What product?
Soap, yes.
Okay. I thought purification from another brand, like such a product that. Okay. Of course. Soapless soap is always a good addition to the treatment for any age.
Calming mask.
Calming mask.
Okay. So with calming, we use calming only when needed, not for every patient, but when the skin is irritated, reddish, inflamed, when the acne is severe, whenever we want to really calm the skin, it's useful to be given a calming mask. It's very effective product. If it's a regular acne without inflammation, irritation, redness, and so, you don't necessarily have to give it.
So it was about children of 9 years of age, right?
Yeah, so no matter the age, if it's children or adults, even children, if the acne is not reddish and irritated, you don't necessarily have to give calming. But if you presume that when you will give Azalite or Azocare, the kid will feel irritated. So if you want for advanced to give calming in order to prevent irritation, that's a good idea. But you don't really have to do it. It's not necessarily, it's not by age, it's by the condition of the acne. If the acne is calm, even if it's 10 years old, but the acne is calm and you give Azocare and you don't assume that you will be irritated, so you don't have to give necessarily to give calming. Only as needed, you know.
Okay, so can we use the calming mask to reduce the inflammation in the case of chronic dermatitis?
Yeah, of course. All kinds of rashes and, you know, when the skin is red, no matter the reason, calming is very good for calming red skin.
So it was the end of the questions that we have, but maybe somebody wants to ask, and so we will wait a little bit for them.
Yeah, of course. I will remind you that we have a professional group at the Facebook. It is called BIOFOR Global Training. So it's a professional group, a closed group for only cosmetologists from all around the world that work with BIOFOR products. You can consult us in this group, and this group is in 2 languages, English and Russian. So if you feel you want to ask in Russian language, our Russian trainer will give answers.
Okay, so the question was, the person used, they applied retinol of the Vivant brand for the 2nd level, and they also washed their face with it, with Vivant. They will send a picture in the chat, and they want to hear what would you recommend in their case.
So what happened to the face after we used the retinol?
So at first it was better, she says. Ekaterina says. But now the skin is sensitive, and there's an exacerbation of the condition.
Yeah, okay. So she will upload the picture?
Yes, we are waiting for the picture. Yes.
It's very common that after retinol usage in acne, we get sensitivity reaction and redness and some exacerbation. Of course, if we stretch the skin, exacerbation is very, you know, very common. So we have to be very careful. That's why we in BIOFOR use azelaic acid instead of retinol in acne.
You use instead of retinol what?
Azelaic acid.
Azelaic acid. Okay. So we still don't have the picture for this one, but she says, which one do you recommend?
Which product?
Yes, which product?
So, but is the skin still reddish? Is the skin still inflamed, sensitive, reddish? That's a beautiful girl. Okay, so the acne is not it's not severe. It's relatively superficial. We see the inflammation. It's not deep acne, not aggressive acne. I recommend at this stage that we stick to Azocare. because the skin is sensitive and it's not severe acne. So we should give her Azocare, maybe Azalite Plus, not more, not Azalite, and in combination with calming mask. So she should apply, for example, Azalite Plus on the affected area, and after 20 minutes, not more, to tap on the skin, calming mask, and to leave it, the more the better.
Окей.
Є питання.
And
Right,
another
yeah,
thing, sorry for the interruption, another thing for this girl, not to start the treatment every day, like to start it gradually, like every other day, or like 3 times a week, and then 4 times and 5 times a week, and then to upgrade, okay? And in the other days, when she does not apply Azalite Plus, she will still apply Cure and Calming. So Cure and Calming every day, every single day. Azelaic acid, we start gradually.
So one person asks, can we apply retinol and azelaic acid in one protocol? And what is the algorithm for the application?
So for the same patient, to give Azalite and retinol, yeah.
Yes.
So of course not in the same evening, never. We never combine those two at the same evening, because it should be very irritative to the skin. You can do it if you decide, if you analyze the case and you see that this is the correct protocol to let this patient retinol and azelaic acid, that could be suitable for some cases. So in separate days. So you look at the condition. If you want to apply, you want to receive more of the effect of the azelaic acid, you should give more treatment days with azelaic, like 4 or 5 days with azelaic and 2 or 3 days with the retinol. Otherwise, if you want the retinol effect more than you want the azelaic effect, acid effect, you should give 4 times, like, or 5 with the retinol and 2 times with the azelaic acid. No matter, you decide, you're the cosmetologist and you know your patient. So you should decide, but clearly not in the same days. Another thing, you should start this treatment very gently and gradually, not for the very first week to treat the patient every evening with this product or another. No, like you should start for the first week, for example, 3 nights with retinol. And then for the next week, 4 times with retinol and 1 with azelaic acid, and 2 no treatment. So the skin can recover and rest. And then in time, you can proceed to every evening, whatever product. Okay?
Thank you, Ronit, for the amazing content.
Welcome. My pleasure.